first electrolyte that I'll be going over is sodium, which regulates the water balance. In high sodium, which is called hypernatremia, sodium that is greater than 145, the signs and symptoms for this are thirst, fever, dry mucous membranes, hypotension, tachycardia, restlessness, muscle twitching, and hyperflexia. The treatment for this is to give an isotonic, salt-free fluid. In low sodium, which is hyponatremia, which is a sodium less than 135, you'll have lethargy, headache, confusion, apprehension, seizures, and coma. The treatment for this is just you want to treat the underlying cause. The next one is chloride, which helps with fluid balance and blood volume and blood pressure. In high chloride levels, which is called hyperchloremia, which is greater than 105, there is no specific treatment to manage the underlying cause. In low chloride, which is hypochloremia, which is less than 97, you just want to treat the underlying cause. The next electrolyte is potassium, which controls nerve impulses, maintenance of cardiac rhythms, contraction of the skeletal and smooth muscles. In high potassium, which is hyperkalemia, which is above 5.5, this is caused by excessive intake and a shift of potassium. The signs and symptoms of this are muscle weakness, paralysis, dysrhythmias, tingling of the lips and fingers, restlessness, intestinal cramping, and diarrhea. The treatment for this is to treat the underlying cause. You can give calcium gluconate to restore normal neuromuscular irritability. In low potassium, which is hypokalemia, which is below 3.5, this is most commonly caused by gastrointestinal and renal disorders, diarrhea, or laxative abuse and diuretics. The signs and symptoms of this are neuromuscular and cardiac effects. You can have hypotension, constipation, intestinal distension, anorexia, nausea and vomiting, and paralytic ileus. The treatment for this is a diet rich in potassium or oral replacement. And then in calcium, this helps the structures of bones and teeth and helps with the clotting factors required for hormone secretion. In high calcium, which is hypercalcemia, which is above 12, this is caused by hyperparathyroidism, and it can be because of a tumor of the parathyroid hormone, which tumors of that and increased levels. The signs and symptoms of this are nonspecific. They can be fatigue, weakness, tired, anorexia, nausea, vomiting, constipation, and mental changes and confusion. The treatment is related to severity of symptoms. You want to treat the underlying cause. You can give oral replacements or IV treatment and large amounts of saline to help excrete calcium. In hypocalcemia, which is low calcium, this is below 8.5. This is because of inadequate intestinal absorption. The signs and symptoms of this are convulsions, tetany, prolonged QT intervals, intestinal cramping, and hyperactive bowel sounds. The treatment for severe is IV. And then the next electrolyte is phosphate, which is found primarily in bones. Hyperphosphatemia, which is anything above 4.5. Cell destruction associated with treatment of tumors and chemo. Long-term use of enemas or laxatives. The signs and symptoms are prolonged calcification of soft tissues in the lungs, kidneys, and joints. The treatment is you want to treat the underlying cause. You can give aluminum hydroxide to bind with the phosphate and be eliminated. And hypophosphatemia is a concentration of less than 2.5. The causes of this can be alcoholism, burns, starvation, and diuretic use. Signs and symptoms are muscle weakness, respiratory failure, heart failure, seizures, and coma can occur. The treatment is just phosphate replacement. And then we'll go over magnesium, which helps with protein synthesis and neuromuscular excitability. In high magnesium, which is hypermagnesium, which is above 2.5, can be caused by renal failure. The signs and symptoms of this are nausea, vomiting, muscle weakness, hypotension, bradycardia, respiratory depression. The treatments are avoid magnesium containing substances. In hypomagnesemia, which is anything below 1.5, the causes of this are malnutrition, malabsorption, alcoholism, lupin thiazide diuretics. The signs and symptoms of this are depression, confusion, irritability, increased reflexes, muscle weakness, tetany, convulsions, and tachydysrhythmias. The treatment for this is IM or IV magnesium sulfate.